function of a health system is to provide health services that are responsive, of high quality, and financially fair to the people it serves. However, to do this effectively and efficiently, a health system requires leadership, staff, funds, information, and other resources which may not be available or adequate. This is where partnerships for health system strengthening come into play.
As a government alone, you alone cannot do it. And there are a lot of stakeholders, interested individuals, our collaborative partners, and they were coming in to lend their support. And one of those is APNet initiatives. They give a lot of logistic support.
Across this, the great partnership we have with them really has helped a lot in terms of, because it helped to, of course, to deepen our intervention, both at facility level, health facility level, and the community level. And equally, we have had, beyond the government stakeholders, we have had great partnership with the church, the faith base. So we work with a network of a lot of network of health facilities that are funded by and run by the Catholic diocese, the Anglican, and of course some of the Muslim community. And this great partnership we have had with them actually have, not only had it helped us to galvanize all the resources needed for the program, because the government's contribution in this project is actually huge.
Through the Icare project, funded by the U.S. President's Emergency Fund for AIDS Relief, PEPFAR, through the U.S. Centers for Disease Control and Prevention, CDC, APIN Public Health Initiatives partnered with key stakeholders at the national and subnational levels to strengthen service delivery for HIV and other public health issues.
Well, you know that APIN has been in the public health space for quite some time. And over this length of years, APIN has built partnerships and coalitions with diverse stakeholders. During the life cycle of the Icare project, we continue to strengthen those partnerships and even build new ones across different levels, both at the national and the subnational units. For example, at the national, we continue to work very closely with the Federal Ministry of Health through NASCAP. We also worked with NACA. We had engagements with the National Primary Healthcare Development Board. We also worked with the Nigerian CDC, and we actively supported, various technical working groups in the HIV program. So we collaborated, to make the positive impacts that we see, especially in the HIV in the country, and also in the public health arena.
The partnership has been able to strengthen the health system, starting from the leadership and governance. They've been able to provide resources to enable program review meetings, particularly the implementation partners forum meeting for the HIV, where key stakeholders from different sectors come together to discuss on the successes of being achieved through the program.
Since the partnership with APIN, we have witnessed a lot of positive changes, ranging from training of personnel to structural improvement to the facility. APIN came in and gave a facelift to the entire facility, from the clinic to the laboratory to the drug center and the pharmacy units. The impact has been so significant.
One major area of intervention in APIN's health system strengthening efforts was in financing for health. APIN worked closely with key stakeholders and actors in its implementing states to ensure that the necessary funds for activities within the HIV continuum of care were secured and released.
In 5 years, APIN supported the states to develop annual work plans, costed work plans, and What this helps the state to do is that they use these work plans as advocacy tools to the government, so that the government can release more funding to support the program. We all know that one of the big challenges that our HIV program has is the over-dependence on donor funding. So we supported the states to create a platform where the states can begin to make critical investments to support the HIV program.
And then also for financing, they've been able to also provide funds to support health facilities to provide effective services to our clients.
As part of its health system strengthening efforts, APIN placed a huge focus on building the capacity of human resources for health and supporting health management information systems in its project states.
From APIN supporting service delivery, APIN really played remarkable roles in building the capacity of state program officers and healthcare workers across those states.
In trying to strengthen the health system, they've been able to support the facilities to bridge the gap of human resource for health by engaging ad hoc staff to support service provision in these health facilities. Also, they've been able to train almost 15,000 healthcare workers across the different HIV continuum of care. Also, the health information management system, they've been able to ensure that the quality of data that is being generated from the service points of quality and then is timely and meets all the data quality requirements.
To further strengthen the health workforce, especially with regards to the delivery of HIV services, APIN, with funding from the US CDC, supported the National AIDS, STIs and Viral Hepatitis Control Program, NASCAP, to launch the National Clinical Mentorship Program, which provides hands-on, day-to-day support to workers at the facility level to deliver quality HIV services.
The program has also been of great impact. Through that, there was an onboarding with the support of APIN, and then there was initial training for the mentors. And through our weekly mentors meeting, we've been able to see the achievements and the capacity of the healthcare workers that are being built through the mentorship program. And with our results from our data, we've been saying that this is a huge success.
APIN supported its project states and provided video conferencing and streaming equipment to health facilities to launch Project Echo, a televisual training platform through which health workers at the facility level could be trained and mentored by subject matter experts and receive guidance to deal with issues in the health facilities. APIN's health system strengthening efforts further came into play during the COVID-19 pandemic. Although APIN's primary focus was HIV programming, the organization was able to diversify and offer its support to the COVID-19 vaccination drive in its project states.
We know when COVID came, there were a lot of interventions. People were restricted from moving about. And we know that the program we support, the HIV, the treatment is unique. If you miss your drug for even a few days, it may lead to resistance. So to ensure that service delivery continues, what we did was to support the state, these 7 states, to constitute their emergency operating centers. Not only that we provided technical support, we also made sure that we provided materials like PPE, so that the meetings can hold, planning can go on. We provided this PPE even to healthcare workers at the facility. When the world developed the vaccines for COVID, we are not originally, like I said, a vaccination organization, but we played key roles. With funding from CDC, we made sure that we supported the state to have, all these 7 states, to have very strong coordinating structures where resources from various partners were aligned, strategies from various partners were aligned, COVID-19 messaging was spread throughout the states. We supported the production of IC materials. We worked with the members of the academia and various stakeholders to make sure that, the widespread, apathy, for COVID vaccines that was around then, we broke them to the minimum and we had results.
A critical partner in APIN's health system strengthening efforts has been the beneficiaries themselves, the network of people living with HIV.
Mentioning also the NEP1, they've been quite instrumental in our successes in terms of retention and viral load coverage in the state, because having support groups which the NEP1 coordinates across the LGAs and the supported sites. The support groups have helped to ensure that education, treatment literacy for the clients continued.
APIN came in around that 2017, and since that time we are together till date. We have been partnering, working together. They are the lead partner in the state, so we can't do without them, they can't do without us. So we have been very cordial all these years. I appreciate their work.
By working hand in hand with partners in its project states, APIN, through the Icare project, has recorded several successes, but these successes can only be sustained and built upon if everyone comes together and contributes their quota to strengthening the health system.
Everybody needs to play his or her role so that we can take, the country's healthcare system to the level where we want it, where it will be able to respond, to whatever triggers that comes upon it.
At the end of this 5-year project, this Icare project in the state, as I said before, APIN did very, very well. They worked very hard. They have been collaborating very well with other implementing partners in the state, CBOs in the state, relevant stakeholders in the state. The collaboration is very smooth, and SACA, being the coordinating body in the state, APIN worked closely with SACA and is collaborating very well with SACA in the state in making sure that activities concerning HIV response are carried out smoothly.
Since the partnership with APIN, we have witnessed a lot of positive changes, ranging from training of personnel to structural improvement to the facility. APIN came in and gave a facelift to the entire facility, from the clinic to the laboratory to the drug center and the pharmacy units. The impact has been so significant.
APIN has supported the state in respect of the HIV program through the Icare project, which is improving comprehensive AIDS response, enhanced for sustainability. They work closely with the Ministry of Health under the HIV program, and supported our comprehensive facilities to provide comprehensive HIV and AIDS services to people living with HIV and AIDS in Benue State. And through that, there have been a lot of achievements, starting from people knowing their status. And over the 5-year period, I'm able to say that over 2 million persons were tested, were reached with testing services who knew their status. And they've been able to also diagnose and put on placement, on treatment, on effective ART treatment, over 230,000 people living with HIV in the States. And also working closely and monitoring these patients to improve quality of care. They've been able to achieve viral suppression of over 96%. And also in trying to strengthen the health system.
So we remain grateful on behalf of the ministry and the state to the key actors and players for making judicious use of this grant and the journey so far that we have made. and we look forward for a more promising partnership.